I want to welcome everyone to the Rio podcast. Today's topic is men's health. We have a very special guest. His name is Dr. Damon Noto, and I want to introduce him to everybody today.
Thank you for having me on.
Dr. Noto, what made you decide to be a doctor, and what was the path you took to get there?
For me, it started at a pretty early age. I had a grandfather who had become sick. He wound up getting some heart disease, and he suffered a pretty significant heart attack at the time. And I was young. It was pretty impactful on me. And what I saw was after the heart attack, he completely changed his life to get back into good health. So I saw his process of healing, his rehab, what he changed, his dedication. So he winded up completely changing his diet, getting very into nutrition, started to do exercise, running. He changed his whole lifestyle, and it made such a huge impact on him, and he completely recovered back to a normal health. And that to me was really something that hit me pretty hard because I started to say to myself, wow, health is very important. The human body is amazing, it can heal itself. So I wanted to learn everything I could about the human body and the healing process. And that started the desire, my passion to learn about medicine. So from there, it just took off. I didn't know exactly that I wanted to do become a medical doctor, but I knew I wanted something with health.
So, preventative care has been a passion of yours
Yeah.
as far as you can remember.
Yes.
Wow, that's amazing. I had no idea. I mean, we've been friends for such a long time,
Yeah.
and I never heard that story.
Yeah, it really did make a big impact on me. And to learn how powerful the human body is to heal, and that it has the potential to heal itself after injury. And how does it go about healing? And are there things we can do to make that healing process faster, stronger, better? That was with me at a young age. And at that point, I started to get really interested in exercise, nutrition. What does it mean to be healthy? So it started at a pretty young age.
And to become a doctor, I mean, schooling is really important, and it takes a very long time. Like, what was that path like?
So you start in college and you start looking at pre-med courses. And at that time, I wasn't convinced yet I wanted to definitely be a medical doctor, but I took some of the pre-med courses. And then, you do okay. You wind up saying, I could do this. So let's go for it. Let's take a shot. And then you realize it's 4 years of college, 4 years of medical school, a year of internship, a few years of residency, then fellowship, and you're a student for a long time.
What's your take on traditional medicine versus preventative medicine?
So when we say traditional medicine, we usually mean that the type of medicine that is practiced commonly in the U.S. right now. So medical doctors after they graduate, or DO doctors after they graduate, they practice a specific type of medicine, which is slightly different than more preventative or functional medicine. I always like the philosophy of you're a better doctor if you prevent disease from coming than if you treat disease after it comes, right? Because if I can prevent you from getting any of those illnesses, it's much better than having to go through, all right, I got the illness, now I have to get over it, right? So I always thought preventative medicine was so important because you want to keep the body as healthy as you can for as long as you can. And when you're healthy, whatever you come across, you're going to handle better, right? So whatever it is, whether that's a virus or a toxin or trauma, you're going to do better because you're in a better shape, right? Your overall body can handle some type of insult much better when it's healthy, right? So we always talk about health as in what's that person's capacity to heal from something that is not good for them. For instance, they ingested something that was really bad or there was some toxin in it. how is it going to have a major effect on their health? Is it going to be a minor thing? The better your health and capacity is, the more you're going to be able to be resilient and be able to go through things. So,
One of the things that has stressed me out about healthcare is that I feel like it's more geared towards let's take care of the problem when it's already a big problem. I feel like preventative medicine, and when I started learning about preventative medicine, I felt like it was a huge game changer because in my mind, I said, why not take care of the problem when it's a baby
yeah,
or before it comes into a big problem? And honestly, preventative medicine changed my life. I think I actually got too into it. Uh, and I just think that preventative medicine makes the most amount of sense, especially when I start thinking about my loved ones, people that are a little bit older, like my parents, for example. Like, there's nothing I would want more in the world to keep them here on earth with me forever. And I'm sure you feel the same way.
100%.
What would be a protocol that you would give somebody that maybe is a little bit older, and talk to me a little bit about that.
So I think one of the best things about modern medicine is these new tests that we're having and developing, and not necessarily to detect illness, but to detect where you might be susceptible to having problems in the future. So like genetic testing is great, but one great thing about genetic testing is it might tell you what you're prone to. Like I might be prone to some mental illness like Alzheimer's or something in when I get older. I might be prone to getting a heart attack or, God forbid, cancer. That way we can work on, all right, let's do everything we can to prevent those from coming. So the basic tests we do for individuals, first we usually do a group of pretty standardized tests that are for everybody. And then we start to hone in specifically for that person as we realize where they might be more susceptible to problems. So I like to say we have to treat people as individuals. There's some common things among all humans, but each individual is slightly different. So for someone who comes to me, I'm going to be pretty extensive in the initial testing, especially if they have a family history of some sort. And then once we get the overall testing back, then we're going to hone in specifically for that person where they might have problems. So for preventative medicine, you're really trying to look at risk. So someone might have high risk for heart disease, really, really low risk for brain issues or mental health issues. So we're going to focus probably on the things that they have high risk for, right? So it's all about decreasing risk so that they can live as long a possible life and a high quality life. Nothing like having a long life, but poor quality. That's not the best, right?
Yeah,
So if you can give someone high quality life for a long period of time, that's a real blessing. So I think for me, looking at where their risk is super important.
I want to talk about men.
Yeah.
We're a little stubborn, we're hard headed, but I feel like men, and specifically, we were put on earth to solve problems, provide, and I know that we carry a lot of that stress
Yeah.
with us. And men are typically not so open about it. They like to keep it in. And the reason why I know this is because it's been my experience. What have you seen to be? What do you think the main issues are with men in specific as patients?
So men, particularly in their 30s, 40s, and 50s, when they're really in their productive years of their career, stress is a huge issue. And a lot of men do feel the burden of providing, of being successful, of accomplishing things. That burden can play a role on a person's health. So what I typically see is someone becomes overly stressed and then they're not sleeping well. They can develop insomnia. They are not able to take care of their health that well, so they don't eat well because they're always on the go and they grab whatever they can when they're running around, right? They're not exercising as much because they're focused on their meetings and their job, and they don't prioritize their health. They prioritize their work, which is understandable, and they prioritize them trying to accomplish what they're trying to succeed at, but they don't prioritize their health. Unfortunately for men, that usually leads to high blood pressure, high cholesterol, being overweight, chronic inflammation. These are common things I see in people who are really driven and in their work. Successful people, like, so you're a successful male, that's great. You've maybe accomplished a lot, but at the same, it could take the price of a lot of your health. So for me, I'm there to remind them, hey, that's great. We need to work on you being successful, but we also need to make sure your health doesn't get sacrificed in the process, right? The other part is that mental part. The mental piece is huge, right? They have the burden of feeling like they need to provide or need to get to a certain level of status. And that can really weigh on them, right? And men are not sharers usually. They don't usually, not even with their friends that much, telling them like, yeah, I'm really stressed out. So a lot of it is internalized, and they can beat up themselves a little if they are not progressing at the rates that they feel they should be. So that can cause problems. That can cause anxiety. It can cause self-doubt. And those mental things that weigh on you, they affect your health. So the mind and the body are connected.
Right.
Super connected.
So when a male comes into Rio Med Spa for the very first time, what does that process look like?
So to me, I'm really trying to get to know that person. So I am really talking, it's not a very stressful interview the first time because I'm really trying to get a feel for who this person is, what do they do, what's their life like, what's their stress like, you know, how healthy are they, what type of medical treatment have they had in the past, do they usually neglect their health, are they on top of their health? So the first interview really is me getting to know the person. So it's very low key. I get a better sense for who this person is. And then usually at that point, I'll make some recommendation about tests. And the first one usually is some type of blood work. And I might say, you know what, after talking to you, meeting with you, I think these are some of the tests we should run. And then the second one is when we start to hone in a little bit more. But the first visit really is relaxing in that it's getting to know the person, right? Because if I don't know you, how can I help you? You're not a piece of paper, right? And that's one bad thing about medicine today is we overread the lab tests, the image, the MRI, and not the person, right? I think it's a big problem. So I'm trying to really get to know this person.
The blood work was one of the most important things to me because it really gave me the facts of my body. I don't know if you remember this. I come to you in 2020, and the 5 years previous to that, I wasn't taking care of myself. I was an athlete in high school. I ran a little bit of track in college. My whole life, I was pretty healthy and fit. And in my mid-20s, I kind of just let myself go. I was just very focused on providing. I was very focused on work and my career. And, I was doing a lot of business dinners, business lunches. And I wasn't ordering the the salads,
Yeah.
And I come to you in 2020, and you tell me, "Hey, when was the last time you did some blood work?" And I remember telling you, I couldn't remember. I think I had done a physical, maybe 10 years prior to that, and I'll never forget. You didn't even wait to let me come in to see you. When you saw my lab results,
Yep.
you gave me a call.
Oh, yeah.
and that meant the world to me, honestly. Um, what do you remember from my blood work to what you see now?
Oh, you've changed dramatically. Because at that time, you really weren't focused on your health and you really weren't thinking about how do I take care of myself, right? And definitely were a lot heavier, not as in shape. I think your energy was pretty good, but I think your energy became a lot better afterwards in terms of how enthusiastic and motivated, energetic you are with life and work. But I remember, blood work are like red flags. Like they're like warning lights. So when I saw some of the results, I was like, whoa. And you're young at the time, right? So you shouldn't be having those things. And I knew it's something we needed to jump on right away. Otherwise, you're going to be in this downward cycle, and your health is just going to deteriorate. So,
The one thing I could remember is I didn't know how bad I felt until I started feeling better. Because in my mind, I was thinking that what I was feeling, the brain fog, the fatigue, the not sleeping well, I honestly thought that it was just a process of life. Like I thought I was a little bit older, even though I wasn't old at all. But I felt like it was my new norm. Do you see that in a lot of your patients as well?
absolutely. And one problem we do see is people forget what it was like to feel good, to feel energetic, to feel healthy, to feel mentally clear. And they, like you said, they have a new norm. And to them, this is normal. This is what my life should be like at this time and this age. And then when you start to bring them back to what real normal should be when you're healthy, they are like, oh my God, I can't remember feeling like this. It's amazing. But actually, it's really just what they were like either when they were younger or when they were really healthy. But I see this all the time. They feel like this is who I am and who I should be at this time. I just accept it. But really, they have a lot of things going on in their body. And once you clear it, they start to be like, wow, I feel good. Yeah. And it can be life changing.
And I'm
Yeah,
sure it's very rewarding for you as well,
it
correct?
is. It really is. Yeah, absolutely. Because people become much happier, nicer. They appreciate life more because they are not struggling so much through the day because they have energy and they feel lighter. It's really rewarding. Yeah.
Doc, I have a question for you. When it comes to the blood panel,
Yeah.
what do you order versus what a primary care physician would order at an annual physical?
So primary care physicians usually are looking at what are the things that are going to kill you. So they're looking at big picture disease wise, right? So they're looking at your liver health and your kidney health, but they really don't hone in on optimizing health. So for instance, they have a 30-year-old male in front of them with all these symptoms. They don't think to run any hormone testing because they're thinking they're 30, their hormones should be completely normal, and the chances of it being off is low, right? So they don't run those tests. They don't run any of the specific nutrient tests like, are their B vitamins really low? Is their zinc really low? Or magnesium really low? Because that's not going to kill you. You might feel horrible, but it's not going to kill you immediately. It might kill you in the long term. They're looking at things that are going to kill you, that are going to bring you into the hospital, right? So we're looking more at optimizing your health. So after talking with the person, I'm looking at all the factors that might be off that are causing that person those symptoms. So hormones is a good one because young men who are working hard, who are not sleeping, not eating well, under a lot of stress, their hormones can drop. Cortisol can go way up, but their testosterone can go way down. And some of the other hormones can go down, or their thyroid can go down. Those are tests the primary doctor is not running. They're not thinking about it, and it's not something that they're going to die from tomorrow. So for us, we're looking at optimizing health. So we talk about preventing illness and also optimizing a person, right? So I want to know all the things that are really low, that are really like not optimal. So I'm probably running maybe 2 to 3 times more things than the primary doctor is. Yeah.
And that was my experience with you as well. I remember the first time I got blood work done, sitting at I think it was LabCorp, and I saw all these tubes, and I'm like, "Whoa, what's going on here?" Like, I've never taken so much blood before. But I remember when we actually started talking about it. Um, so much of my levels. I mean, I don't even want to bring up what was low because it'll take up so much time. One of the biggest ones for me when it came to hormone or replacement therapy was testosterone. And for men, testosterone was very important. It literally brought me back to life.
Yeah.
Talk to me a little bit more about testosterone in specific.
So testosterone and low testosterone is almost like an epidemic in our country right now, especially middle-aged or younger men. We've never seen it like this before, in that testosterone levels are so low, and cortisol is so high. So testosterone has become a major issue for men, and they don't realize how important it is until you replace it and get them back to where they were, where they should be in their 20s or where they should be in their 30s. And you realize, whoa, I have energy. I don't have to fall asleep in the afternoon. My thinking is clear. I'm driven. Testosterone is especially in balance to estrogen, cortisol, DHEA. When it's in balance, you feel so much better. So to me, testosterone has been a real game changer for some men. The other thing it does is when men get older, they start to eat more easily, gain weight, and lose muscle, right? Part of that is because their hormones are off. So even if they're exercising the same, they're not getting the results they used to. So they go to the gym, but not able to build the muscle or strength they used to be able to, and they put on fat a lot easier because their testosterone is so low or their estrogen is just too high. So balancing that it can be a game changer, especially for younger men.
I've talked to a bunch of my friends regarding testosterone, and one of the big fears in men is the needles.
Yeah.
It's so funny because the guys, big tough guys,
Yeah.
they're not afraid of much,
Yeah.
and they're afraid of the needle. But there are many other ways
Yes.
other than the injections that you recommend.
Oh, yeah. It's come a long way. I mean, we have everything now from pills that are safe, creams, patches, pellet therapy, which is placing a little bit of the small balls of medicine in you that release over time. There's oral sprays. There is everything now. So literally, no matter what your fear is, there is ways around it to get onto some type of replacement. They even have what's called an auto injector now, which is basically you don't do anything. You put it to your skin, you press the button. You don't even feel it went in. It's amazing. The technology that these companies have is really very good. And no matter what type of obstacle someone may have, there's a way around it for sure.
The last question I'm going to ask you about testosterone.
Yeah.
At what age can you benefit? Is there an age?
I mean, we see it younger and younger. We used to think 20s should be great for a person for testosterone, but now mid 20s people we see are super low, really, really low. Like they're a 75-year-old man low. So you have to remember with testosterone, there's total testosterone and then there's free testosterone, right? Free testosterone is the testosterone your body can use and what's actually active. A lot of men can have a fairly decent total testosterone, but their free testosterone is so low that it's basically like they don't have any testosterone. And we're seeing that at a younger and younger age. We don't know why. We can guess a lot of reasons, but it is something over the past 20 years has progressively become a bigger and bigger problem.
What about in the a man who's 60, 70? Is there a cutoff time?
No, not at
You
all.
can
Until you should balance hormones until the end, right? I mean, there is no point in a person that they shouldn't be optimized. Now, should an 80-year-old male have the testosterone level of a 19-year-old? No, but they should have a healthy level, not zero, which we see all the time. Yeah.
Now I want to talk to you about a problem that you made me aware of, and it was chronic inflammation.
Yeah.
I didn't know much about it. I never had learned about it before, and I definitely want you to talk a little bit about inflammation, especially in men.
Yeah, inflammation is a big problem, and it can come about from different reasons. A lot of men, they can have develop what we call insulin resistance or maybe pre-diabetic, in that they don't process sugar very well or carbs very well. So what happens is you eat carbs like you used to, but those carbs don't get pushed into the muscles and cells like they should. They stay in the bloodstream. When it stays in the bloodstream too long, it becomes inflammation, and it inflames the vessels, it inflames the blood. And where does the blood go? Everywhere, to your brain, to all your muscles, to your organs, right? So one aspect of inflammation could be a sugar problem, right? The other aspect of inflammation could be what we call a lipid problem or a cholesterol or a triglyceride problem, right? When your lipids are super high, they clog your arteries. When you have clogging of the arteries, then your blood is not flowing as well. What happens when it's not flowing as well? Well, inflammation starts to build up, right? Third factor, and it's becoming more and more a problem, is the stomach, is the gastric system, right? What we're eating today and our ability to digest things is changing. The quality of our food, the type of food, processed foods is changing our GI tract. The problem with that is the GI tract, everything that goes through there eventually either goes into the blood or gets pushed out. But anything that goes into the bloodstream, if it is even slightly toxic, is causing inflammation throughout your whole body. So, for instance, gluten has become a major topic for people, right? And we know that gluten, if you're sensitive to it, or if your body doesn't have the ability to really break it down, and if it enters into the blood, can become a major problem for people. So brain fog in people who are gluten sensitive or have gluten intolerance, like they can't take any gluten, they can get brain fog within 15 minutes of eating gluten. All of a sudden, they just can't think. And they think it's normal. Oh, I've been like this for 20 years, you know? And then all of a sudden you're like, well, no, something's going on with your digestion. We need to fix this. And when you fix it, they're like, oh my God, I can think again. Like, I don't have that cloud in my head, right? It is life-changing sometimes, right? But gluten is not the only problem. It could be lactose. It could be a lot of different things that people are eating that they don't realize are causing a problem for them. So one part of chronic inflammation is the gut or the stomach. And your stomach and gut are so important. What a lot of people don't realize is the neurotransmitters like serotonin, GABA, these things are for your happiness, and so you don't get depressed. A lot of it is made in the gut. So when your gut is off, you can get depressed. You're not making the neurotransmitters that your brain and body needs to stay happy. So it's affecting you from mind all the way to your, physical attributes. So it's a huge part of your health.
Diet in men.
Yeah, diet.
That's
in men.
another topic.
Tough.
And also want to talk about weight loss.
Yeah.
The foods that we eat in America are much different than the foods overseas.
Yeah.
When it comes to diet and also weight loss, what are you recommending, and how do you treat patients that are overweight?
It's really individualized because there you could develop the best plan for somebody. oh, this is going to be perfect, you're going to lose weight. But if it's not feasible and they're not able to really actually implement that, who cares? They just doesn't work. They do it for a few days and they go back. So I really try to tailor it to that person, right? So if they're the type of person who is in meetings all day long, they have no ability to bring in food from home, we have to come up with a game plan so that they're able to eat healthy food, either throughout the day or in the morning or the evening. So I really try to tailor it to that person. So whole foods, like really nutritious whole foods, is obviously much better than processed foods or foods you pick up either at a restaurant or in the supermarket. To be able to get whole foods into a person is a major priority, right? Men in particular, do you know what's the average amount of vegetables a man eats every day?
Not a
If you had
lot.
to guess, what do you think?
I would say
3, 4, 5 vegetables?
4 ounces.
It's about one. If a man's eating one vegetable a day, they're like above average. I'm talking just one vegetable, right? So in general, you want to get in 3 to 5 vegetables a day would be ideal. We struggle with men to get in one. So to try to get someone's amount of vegetables in, the amount of fiber they need, the amount of fluids, water they need, they're drinking maybe two cups of water and 2 glasses of coffee. You're like, whoa, we got to hydrate, right? So first you have to look at the big picture, like, okay, what type of foods are they eating? How much water are they getting in? How much protein are they getting in? And then we can dial into, all right, how can we make this feasible? I'm a big fan of meal prepping because for men on the go, you're running from meeting to meeting, different place. It's really hard, right? So if you don't have that food with you somewhere already, you're picking up anything you can get. Once you get starving, you'll eat anything, right? So 7-Eleven is there, you're starving, you're gonna go in, you're gonna eat anything that you can grab, right? So we need to come up with a game plan that the food is there. When they're ready to eat, it's easy to put together and they can start eating it quickly. So I'm a big fan of the meal prep, right? Usually if you can get good whole foods into somebody, enough hydration, then you're usually not overeating to the point where you're gaining a lot of weight in general. So to me, first I try to focus on, let's get them into a healthy diet. Then we can start talking about, okay, what do we need to cut out? So some people really like sweets. Some people really like salt. Some people like chocolate, So we need to find out where their weaknesses is and try to decrease some of the weakness and replace it with something that's more wholesome or good for you, right? So diet and nutrition is huge. Inactivity, sedentary, is also huge, right? How many men you know are so busy that I don't have time to go for a walk, I don't have time to go to the gym, I don't have time to exercise. Okay, eventually you're going to get out of shape and overweight.
And sitting's been a big problem as well.
Sitting is a killer, right? I mean, you just sit all day long, right? You're meeting after meeting and meeting. So getting people active and moving is huge. Because once your metabolism is working better and you're actually burning calories through activity, it's a lot easier to lose weight. I could put you on the best diet in the world, Ozempic, all these things, but if you just sit around all day, it's still really hard to lose weight.
You mentioned Ozempic, and most people know about that drug. There are some other ones that men are really benefiting from. Talk to me a little bit more about that.
There's now more than Ozempic on the market. There's another one so tirzepatide and semaglutide. They're all GLP-1 medicines, but they're working through different mechanisms. And to be honest, we are getting more and more advanced ones. So instead of working on just one pathway, we have some working on 2. Another one coming out probably this year will be working on 3 different pathways. So the potency is getting better. One really good thing about the GLPs is that they decrease hunger and cravings a lot. So if you're the type of person who's just like, I always feel like I need to eat no matter what I do, I'm craving. These medicines are a game changer, right? It makes it a lot easier to be compliant with your diet. So do they come with side effects and risk? Yes, all these medicines do, but used properly in the right person, can make a huge difference, huge difference. And I always find that once people get a good start, like let's say they lose 10 pounds and they see good results, all of a sudden everything changes.
That was the case for me.
Yeah,
Once I saw that it was working, it gave me all the motivation to get up early, go to the gym,
exactly.
start meal prepping.
Exactly.
And honestly, it just became, for me, it became a lifestyle.
Yeah.
It was, and it still is my lifestyle.
That's wonderful.
The one thing that I want to talk to you about that I'm most excited about, because I'm currently on this journey right now, are the peptides.
Yeah. Peptides are exciting, I have to say. Yeah.
I'm taking a few right now. I'm already seeing some benefits. Um, the BPC 157. I know there's a lot of information out there. What some are FDA approved, some aren't. But I do want you to talk about the peptides because it's something that people ask me a lot of questions about.
Peptides are exciting. And I would say that it's advancing very rapidly. You know, one thing about peptides is every month there's new ones being found and being released. Peptides are little proteins in the body that naturally exist in the body. We're just finding they're like little signal molecules or little hormones, right? And they're already in your body. And we're finding out what all these little proteins are. And we're able to make them in a lab and then give them and offer them to patients. It's even hard for physicians to keep up with the advancement in peptides because more and more keep coming out. So the benefit of peptides is that we are seeing rapid development in many different types of specialties because of these peptides are able to treat so many different types of things. The negative thing would be is we don't have as many clinical studies on these or human safety studies because there's not a pharmaceutical company that's putting it out that's making a lot of profit off of it. So they're not interested in investing millions and millions of dollars on safety or anything. So a lot of it is, we know it's really, really good, but we don't know in long-term studies, what's the right dose or how long should you be on it? A lot of the intricacies of the newer ones, it's harder for us to know because they're so new and there's not these big research studies behind them, right? Saying that, they're really powerful, right? Some of these are amazingly beneficial, from weight loss to sleep, brain health, inflammation, sugar, lipids. I mean, you name it, there's peptides coming out for it. Muscle growth, every type of aspect you could think of, there's going to be peptides for, and it keeps coming, right? So it is really exciting. I would say the nice thing is that the FDA looks like they're going to be approving 10 to 15 peptides coming out within the next couple months, which will make it a lot easier for physicians to start to use it openly with patients and give us a lot more clinical experience with these. Because a lot of them before were basically, FDA said, don't prescribe them, don't be giving them to patients. That's changing a little bit. Now we're going to have the ability to freely be able to prescribe these and use them. So that's a game changer. I think pretty exciting. Peptides are going to be a big part of the future of medicine. How it's going to happen or which way it's going to take is going to be interesting, but patients are driving it because patients want it. They want these results and they don't necessarily want to be on pharmaceuticals or certain types of drugs to be able to get those type of results.
For any man that's listening to this podcast today, tell them where they can find you, what would the first step would be, and explain the process just a little bit as becoming a patient at Rio Med Spa.
I mean, reaching out to Rio Med Spa, say you're interested in men's health. You might want to say you're interested in preventative medicine, like I'm really healthy, but I really want to optimize my health. Or you might tell them, I'd like to make an appointment with Dr. Noto, and it can even be what we call a telehealth appointment at first, and say, like, I'd like to meet him and and talk with him about what we could do to optimize my health or preventative. Or I have some symptoms I'm going through. I'd like to see if he could help me. And then from that point, they're going to schedule a time for us to meet. We get to know each other a little bit. And then I'm going to probably recommend, okay, let's do this first. And there'll usually be some testing, right? And it'll be pretty low key. We're not trying to pressure people to do certain things. It's more like, how far do you want to take it? How much do you want to invest in your health? If you want us to go really in depth and very thorough, we can. If you're like, well, I have some of these issues, I'd like you to see what we can do to adjust them, we can stay more focused. But in general, we can give you a sense of your overall health and where you might be lacking, where you might need to improve. So give a call to Rio and just schedule an appointment. And from there, it's a pretty easy process, to be honest.
And the one thing that I'm going to conclude by saying is that uh, this absolutely changed my life in every way. Um, when I embarked on my wellness journey and started working with Dr. Noto, um, you know, I lost, I think, 50 pounds over 3.5 years, working out every day. I literally feel better today than I did when I was 22 years old. I have anyone that knows me personally knows that I have a lot of energy. I wake up every day and hit the gym really hard. I do try to eat healthy most of the time. I'm not as strict as I was early on, but I just want to let you know that Dr. Noto absolutely changed my life. And Doc, I really want to thank you for being here today.
My
And
pleasure.
this was a lot of fun.
It's great. It was great to be here. And I'm really so happy to hear how much it's helped your health and life. So thank you again. And I'm glad that we could be a part of your journey.